Good morning, everybody. This is Justin Jacobs. He's almost 12. I'm just going to wait a few more minutes for anyone that's going to be logging in here, and then we'll get started.
Son estos, por ejemplo.
Just going to give everybody just an extra minute here. All right. Good afternoon, everybody. Thank you very much for joining us today. And I know most of you are working through your lunch break and you're probably hungry, so I'm going to do this as quickly as possible here. It should take us about 30 minutes or so to go through the presentation. So what we've done, Miss Ashley and her team at Physician Partners has asked us to put together a quick snapshot of what's happening in the market for Central Florida on Medicare, specifically for Medicare Advantage. My name is Justin Jacobs. I've been an agent for going on my 13th season here, and I started out doing health insurance in Medicare Advantage specifically. And back then, we only had two plans to really worry about. Back then, it was Humana and WellCare, so it was very easy for brokers like myself to offer Medicare Advantage. And as the market matured, we had more and more competitors coming in, and that's what's happening now. So it's becoming a very mature market for Medicare Advantage. So we created an agency to help not only the seniors but physicians to understand what's going on there in the marketplace. Health Plan Markets is an agency that we are independent. We are independent benefit advisors, and we represent most of the major Medicare plans. And it's our job, we basically go out there and sit with the seniors and figure out what plan is going to be best for them. There are over 18 different carriers in this market offering over 90 plans. So for a senior, what happens is they get paralysis because there's just too many options. So our job is to sit down with them, and based on their physician selection and their medications and the benefits that they're looking for, we are hired to help them figure out what plan is best for them. I also have a background in marketing for physicians. I used to work for an MSO many years ago. And so I bring that expertise when it comes to marketing your practice and also with your patient retention. So if you have any questions after this, you can get with Ashley or one of her teammates to answer those questions and to see if I can help you with your marketing needs. So with that, we have a lot more plan options this year. So in your backyard, there are new plans. Um, what you really need to know, I'm going to do a very high level view of what's happening out there because there are a lot of details, specifically with new carriers and new plans that are coming into the market. Benefits are changing. Most of them are changing for the better when it comes to the seniors, which means lower copays and added additional benefits that didn't exist before. And the purpose of this is not to overwhelm you. What I'm trying to do with this presentation is to show you some key differences, what really makes each plan unique and who it's suited for. So the big question that I get from providers, you guys take most of the health plans, but how many plans do you really need to master in order to communicate with your patients and their needs? And the answer is really none of them. We go to school for insurance and we have to do certifications on a yearly basis. So it's you can take that off your plate. You don't have to answer insurance questions when you have patients there. It's your job to keep them healthy, and we're here as your customer service when it comes to the insurance needs. So our benefit advisors, we have over 90 different plan options to choose from with 18 different Medicare health plans. So this is a lot of information. This is exactly how my brain looks. They did miss the pizza. I like to think about pizza from time to time, so that's somewhere in there. But every year we have to go through certifications, and every year we have to relearn each plan. So each of the benefit advisors that we work with are insurance agents, and they have to go through annual testing. So for you to memorize all this stuff, we really don't need you to memorize all this. You've got enough on your plate. So what we're trying to do is when you have a senior out there that's looking for information, you get them to an agent and we'll get them on what they need. Really, this is for you to understand exactly what's offered for each carrier and the high levels there. Here in Central Florida, just so you know, Medicare eligibles are exploding, not only in the country, but here in Central Florida, we've got a very high population density. Over 500,000 people are here on Medicare that are eligible in Central Florida. The big number that I like to look at is your Medicare Advantage penetration rate, which is 44.7%. This is high. I mean, you've got almost half of these eligibles on Medicare Advantage, which is great. You're in the right business. And it's also continuing to grow. So year over year, you're looking at over 6% of growth. So Medicare Advantage is not done growing. Central Florida is a mature market. However, it's still got room to grow. If you look at markets like Miami and Tampa, this number on Medicare Advantage is in the 60s to 70%. So very high. So looking at that and looking at the trend, you can expect to see more people on Medicare Advantage in Central Florida in the future. I'm going to go through this very quickly. Everybody knows what Medicare Advantage plans are, hopefully by now. With physician partners, they're showing you exactly what is necessary in order to keep your patients healthy and to keep your scores nice. It is Part C, so again, Medicare Advantage is run by private insurance companies. All of these are private insurance company options, and all the plans that I'm going to discuss today are what we call Medicare Advantage and prescription drug plans, so MAPD, and all of which are either HMO or PPO options. And they have to have Part A and B included in order to join a Medicare MAPD plan. So they have to have A, and you have to have B. If you're missing one of those, unfortunately, you can't have Medicare Advantage. Some plans have an optional Part D with prescription drugs. That's all baked in together. MAPD is built just like this: Part A, Part B, and Part D all together in a nice, neat package, just like you used to use at work through their employer. So they're used to this kind of package together. So that's it on Medicare Advantage. You have to have A and B. So some folks will come into your practice and say, I only have A or I only have B. We can get them prescription coverage, but we can't put them on Part C Medicare Advantage. So that's important. Okay, so with that said, I'm going to jump into benefits very quickly. Again, this is a high-level overview. I'm only touching on a few different things and the highlights that really make the plans unique. for you, because I think that that's important in case you have patients that have questions on what they're looking for. So all of this is in alphabetical order. The first plan up is Aetna. In some markets, specifically in Polk County and in some parts of Lake County, it is also branded with Coventry. So Aetna is going through a brand merging right now between Aetna and Coventry. So you're going to see some folks on Coventry, but it all lands under Aetna. So this year they did add Lake County to their Medicare Advantage expansion area. So this is a new area. It is in Orange, Osceola, Seminole, and Polk County. This year's 2019 star rating has been released. It is 4.5 stars out of 5 stars this year for Aetna. So they improved year over year. They went from 4 to 4.5. They're moving in the right direction. They only have one new plan in this area that's coming out, and that is their PPO product. Again, with your relationship with physician partners, it's not a focused product, but it is out there, so I'm going to share that with you a little bit because you may have some patients that are assigned to you under the PPO. So we have 3 different plan options from Aetna, all of which are 0 premiums, so the member does not need to pay a monthly premium in order to join this plan. They simply pay their Medicare Part B premium. For next year, the Part B premium is $135 and change. So they just continue to pay that. That comes out of their Social Security check. With Aetna, their flagship plan, the plan that they focus on, is the Medicare Select plan. They did not make very many changes on this plan this year. So you're going to see basically the same costs that you did last year. So the PCP visit is 0. That's pretty standard in our industry, so you won't see any PCP copays when you see your members. Specialist, $25. On the Medicare Choice Plan, they lowered this, so that's why it's in green. So I look at that as an improvement. They lowered that to $25. They also lowered their deductibles on their prescription drugs for brand name medications and non-preferreds. On the PPO, it's a little more expensive because, as you know, they can go in or out of network. So their specialist copay is $50 across the board. On the Medicare Select plan, and this is the one most of our agents lean towards because this is their flagship plan. Again, no deductible on the prescriptions. Tiers 1 is generic, 2 $15, tier 3 $42, and tier 4 $100. All those specialty medications are at 33%. And all of which the extras that you see on these plans, the gym, the vision, the dental, hearing, OTC, pretty standard in our industry. Nothing really to write home about on Aetna, but the big selling point on Aetna is the name. You'll be hard-pressed to find anybody that has never heard of Aetna or at maybe one point has been on an Aetna plan. So really their whole thing is their name, and it makes it very easy for us to sell. Again, most of your patients are going to come in looking at the Medicare Select plan, be enrolled in the Medicare Select plan. Moving on to Allwell. So Allwell is also going through a branding change right now. They were previously called Sunshine Medicare. So some of you are contracted on the Sunshine Medicaid product. They have converted their Medicare line of business to Allwell. Allwell is available in Orange, Osceola, Seminole, and Polk counties. But with the new brand came a new contract code. So their new contract code is too new for a star rating. So Medicare does not have enough plan information and codes in order to see exactly where they land as far as a star rating. So we're probably looking at another year, maybe 2 years before we see a star rating from Allwell. They do not have any new plans. And in our market, they have one core plan. And we call core plans people that have Medicare only. And they're kind of backing off on the copays. Their main line of business is Medicare, Medicaid plans. I didn't have this information loaded because I wanted to make sure that we were focused on open enrollment since we're right in the middle here. 0 premium, 0 PCP copay. Specialists went up to $30 this year. So that is not an improvement. They kind of backed off a little bit. Copays on the meds are pretty much standard as well. They have a 6th tier, which is a select care plan. They do offer transportation and dental, so that's what they're strong at doing. Their transportation is very rich in benefits, as well as their dental for these plans. So what they do is they give you a credit, and that credit the member can go to the dentist and get things done. So it's comprehensive. It could be an extraction or a root canal, and they can use that credit to get their dental done. So that's a very strong pull into the OL brand. Moving on to CarePlus. So CarePlus has, I was speaking with Ashley this morning, they've kind of combined their sales territory. I call it moving the fences on us. So they've now combined Orange, Osceola, Seminole, Lake, Marion, and Sumter counties all in one market. They've got Brevard as a separate market and Polk as a separate market as well. This year, in 2019, they have achieved the full 5-star rating. So what that means to you as providers is hopefully you should see a bonus structure there as long as we're doing all the right things. That is the highest star rating that you can get with CMS, which means that they are paid the highest amount allowable through CMS, all of which is great for the provider side. And from the sales perspective, where we come in, we're able to enroll people in CarePlus all year round, even outside of open enrollment, only because they've got a full 5-star rating. So if somebody comes in to your offices in April and they don't like the plan they're on, they can join CarePlus without an excuse, just because they have a 5-star rating. So this is a great piece when it comes to marketing. CarePlus is going to do exceptionally well. They were 5-star a couple years back, and their growth went through the roof. So they did really good there. And they didn't bring in any new plans this year, but they did make some really big improvements in order to make the plan more competitive in this market. So their flagship plan, their the one that they call their leading plan, their core plan, is called the Care One Plus. And in our market, it's a zero premium, zero PCP. They improved the specialist copay and dropped it down to $10. So this is one of the lowest copay plans in the market. In fact, I was looking on it this morning. CarePlus is the first selection when you are searching for plans in our area on Medicare.gov. Which, by the way, if you guys haven't used that website, it's a great tool to see all the details on the Medicare Advantage plans. So CarePlus comes up first just because of their estimated cost for the member on a yearly basis. The prescription drug cost, they got rid of their Tier 1 and Tier 2 copays, so all those are zero, so your preferred and non-preferred generic medications are covered. You've got your brand name drugs at $30 and non-preferred at $85. They're huge on transportation. So for the last couple of years, CarePlus has unlimited transportation to their doctor's offices, which includes the PCP and specialists. They will even take members to their Silver Sneakers classes at gym. So this has been a really big pull into why people should join CarePlus. So if you have patients that are struggling to make their doctor's appointments because of transportation issues, they might want to take a look at CarePlus because at this time they're the only plan that has unlimited transportation to providers. They've also increased their dental benefits. They're now offering dentures to all of their members at no cost. So that's a really big thing that they've done this year as well. They do have a Part B money back plan. Again, we're not too fans of this plan because seniors are coming in. It does raise the copays here, and it also lowers your reimbursements and your bonuses. So it's out there. This year, CarePlus is giving back $80 for a member if they join CarePlus on this particular plan, the Carefree plan. In Polk County, it's a little bit higher. It's $110. And in some other markets, it's a little bit higher. But here in Central Florida, you've got an $80 give back plan. Copays, again, they improved it to $20. Transportation and dental is the same, so that's through the health plan itself. And then the Care One plan out in Brevard County did make some improvements. All of these are zero premium plans. They also got rid of their tier 1 medication cost, so that's now 0. And that transportation and dental there is going to be a hot seller for them. So Care Plus, 5-star plan, I think that they're going to really clean it up this year as far as getting new membership. We have a new player in town, Cigna. Although Cigna has been around for many years, and they are new to Medicare Advantage in our area. So they have come in to the service area for 2019 for Orange, Osceola, Seminole, Lake, and Polk counties. Amazingly enough, they have also achieved a 5-star rating. So the same rules apply for Cigna as well. So although they're new to us, they are not a new health plan. They've leveraged this 5-star plan through their contract code in Miami. And they've done so well down there that CMS has given them the whole state of Florida. So their new plan is their Cigna Health Spring Preferred. Here it's a standard plan. They've got one plan selection. It makes it very easy for our agents. It is a 0 premium plan, 0 PCP, $25 specialist, and not the lowest in the market, but pretty fair. Tier 1 and Tier 2 are 0 copay, so we love that when we see the generics. Brand names are very reasonable as well. Their extras, we didn't really see much to write home about. They do have vision, dental, and hearing. Transportation is limited, but the big call to action here for Cigna is that, again, that 5-star rating. So they did a really great job rolling that out into a new market. And definitely a way to introduce yourself to a new area. So 5 stars coming in, and so we've got Cigna now in our back pocket. Also have a new player, Devoted Health. So Devoted is not in Orange County, or Lake, or Volusia, or Brevard. So if you haven't heard of it in those areas, no big deal because they're not there yet. They are only in Osceola, Seminole, and Polk counties in our market here. So because they're a brand new company based out of Massachusetts, they do not have a star rating yet. So it's going to be a couple years before we see a star rating and they're actually getting their numbers in and their scores in from CMS. So it may be a while before we see a star rating from them. Just to give you a little bit of a backstory with Devoted, they're owned and operated privately. A lot of people from the tech world, people from popular websites like Wayfair and Google, and even some folks from CMS all came together and put this health plan here. And their first market was Florida, and they specifically seeked out our market for whatever reason. They went for just some select areas here. And they have 2 plans. So their big thing here is very interesting. Their core plan is pretty standardized. It looks a lot like how Cigna came in with 0 premium, 0 PCP, $25 specialist, low copays with the generics. Dental is going to be a really big thing here with the comprehensive as well. But they have a very specific plan for folks that have LIS, or what we call low income subsidy. This program is a government program for folks that have lower incomes in order to qualify for additional help with their medications. So if you have a member that is struggling to pay for their medicines or believes that they're paying too much for their meds, based on their income, they could qualify for a program for LIS. And if they have LIS, then they would have a 0 premium on this. If they don't, then they do have to pay a premium of about $30 a month. But what's attractive about this is if the member qualifies for LIS, not only will they have a 0 PCP copay, but they would also have a 0 specialist copay. So someone that has a lower income, this is going to be a super big part of what they do as far as lowering those costs out of pocket and making sure that they're staying compliant and doing all the things that you need them to do. The medications, what happens is LIS is standardized, so they pay no more than $8 per prescription. So all of these copays kind of go out the window if they qualify for LIS. Again, all the gym, transportation, vision, dental, hearing, and over-the-counter credits are available through Devoted Health. So a really great, strong plan. And this is unique. Nowhere else in Central Florida do they have a plan built like this. So I think that they're going to be very successful with this particular segment of seniors that qualify for LIS. Now, just so you know, in case you're unclear of how this program works or you'd like more information, or if you'd like to work with one of our agents are trained in LIS and can help your members qualify for LIS so we can get them in a plan where everything is zero copay. And of course, help them get their medication costs down so that they're compliant on their meds. So we can definitely help you with that, so just let us know. Freedom Healthcare, very strong presence in Central Florida for many years. They didn't add any new plans or service areas, so they're still in Orange, Osceola, Seminole, Lake, Brevard, Volusia, and Polk counties. So they haven't added any expansion areas this year. They are 4.5 stars, so excellent star rating there for Freedom. For next year, they didn't move the needle at all, which is not a bad thing. Because as sales agents, we want to make sure that our members aren't changing because of copays. So they still have very, very competitive copays. Zero premium on their platinum plan, zero PCP copay. Specialist copay is $15. They only have 4 tiers on their particular plan, which makes it easy. And they also have what we call gap coverage. So if a member is specifically on certain medications that are in tier 1, if they hit a certain out-of-pocket cost for next year, that those copays drop to 0. So if they stay 0 through the gap, they don't have to pay a percentage towards those medications. They have all the same strong benefits: gym, transportation, vision, dental, and hearing, as well as over-the-counter credits. And those credits vary depending on which area that they're in. In Brevard County, a little bit higher copays. Obviously, this is their core plan. Still 0 premiums, still 0 PCP copay as well. Medications are a little bit higher, but all the same great extras that you get with Freedom as well. Humana. So many of you are new to Humana, especially with physician partners. They recently added that product to their network. So in our area, we have Brevard, Orange, Osceola, Seminole, Lake, Polk, and Volusia. Now, each one of these plans are in these service areas, but the benefits may vary. So, for instance, with Humana, they are in a separate market for Brevard, and Polk and Volusia is on its own too. So you might see some slight benefit changes when you cross over into those counties. What I like about Humana is they've always been strong on their star rating. So again, another strong star rating, 4.5 stars. No new plans for this year, but that's okay because they lowered a lot of copays. So they are also being very, very aggressive with their growth strategy for this year. Their flagship plan is called the Gold Plus 146. This 146 plan is in Orange, Osceola, and Seminole counties. Again, you might have a different claim code when you go into those other counties. I'm focusing on this just for time reasons here, because you can go all day with all of the other plans in the areas. But this is their flagship plan, 0 premium, 0 PCP, only a $10 specialist copay. That's the lowest I've ever seen Humana drop their specialist copay. So very, very aggressive strategy in capturing membership this year. You can't turn on TV without seeing a Humana ad also, so they're spending a lot of money on marketing. On the prescription side, there's no deductible on any of their plans, so their members either pay 0, 5, 35, or 85, depending on which tier level that they land in. Very strong gym, transportation, vision, dental, hearing, and OTC. The big call here is just those lower copays. So people that are on Humana this year are going to be very happy with what they see next year. They do have give back claims available. Again, we only recommend those for folks that are super healthy and really don't need to see the PCP but once a year. Those have higher copays, so obviously we don't want to put people that are going to see a lot of specialists on this plan. They're better off on the standard Gold Plus 146. And you can see that difference here. If they give money back, the copays go up. They do have less extras here as well, but that's all in the package when it comes to Humana. Their PPO option, very strong PPO and LPPO, which is a local PPO that's becoming a trend here. It's also a zero premium, a $5 specialist copay, or I'm sorry, primary care copay at $5. Specialist is $35. So when you give people flexibility, they're going to pay for that. So if you're in network, it just makes sense to get them on that HMO because they're going to pay less copays on them. Sometimes people sign up for a PPO and then they come to realize that they can get the HMO and keep the same great doctors without having to pay higher copays. Optimum, in Central Florida, we consider this freedom country. However, Optimum last year was a 5-star rating. They recently dropped down to 4.5, so still not a bad rating. However, we won't be able to enroll year-round with Optimum for 2019. They are available in Orange, Osceola, Lake, Seminole, Brevard, Polk, and Volusia counties. There's no new plans, but again, that's not bad news. They're pretty consistent across the board. So their flagship plan here is called the Gold Rewards. Zero premium, zero PCP, $35 specialist there, and there's no deductible on the meds. Again, only 4 tiers on Optimum, so they're mirrored as a sister company, just like Freedom, and coverage in the gap for their tier 1 medications in case they hit the gap. Same great extras, vision, dental, hearing. OTC is a really strong pull for both Freedom and Optimum. And they do have a little bit of transportation. Out in Brevard County, they have a unique plan. They're CSNP members. So this is a chronic special needs plan. And based on their chronic need, they could qualify for a special enrollment year-round. And on that Diamond Rewards plan, it is a zero premium, zero PCP copay, a little bit higher specialist cost, but those folks that qualify for one of those chronic conditions can enroll year-round. They don't have to wait just for open enrollment. So if you have folks that are not happy with their plan, come after December 8th, we can still help them out in Brevard as well. Simply Healthcare. So Simply, they do have a new plan this year that they've added in. I'm going to explain that in a moment. They've stayed pretty strong with their 4-star rating. They haven't moved the needle there. No new service area expansion, so you're still in Orange, Osceola, Seminole, and Polk counties. Benefits in Polk are slightly different, so just make sure that you're aware of that. So for next year, their core plan is called Simply More. Zero premium, zero PCP copay, $15 specialist. So again, they kept it very low and competitive. Tier 1 and Tier 2 meds are at zero copay there. Interestingly enough, this year they are covering in their over-the-counter credits, they have ED drugs available. So that's, some of these plans do also have erectile ED drugs there that are available in their OTC catalogs. So if you have patients that are interested in learning about that, Simply does have a very good credit for that. You got to watch those guys. Simply Select plan, this is their new plan, zero premium, zero PCP. Specialist is only $10. This is also going to reflect on what happens with the prescription drugs. LAS eligibles and copays do vary, so just like Devoted, we can help them qualify for LAS and get them on a plan where their copays are low. So this is what we call a partial Medicaid design plan available for the general public. So you've got a zero premium, zero PCP, very, very low copay. So this is going to compete with your Humana members. Again, those ED drugs are available. They have gym. Transportation is very strong, and dental is very strong on Simply. So those are those highlights there on Simply. United Healthcare, of course, everybody knows United. That's the 800-pound gorilla in the nation, the #1 insurance carrier for health insurance. So you've got Orange, Osceola, Lake, Seminole, Brevard, Polk, and Volusia. In our area, the local PPO has been expanded to Orange County. Also, Volusia County has added the HMO for the first time. So in those areas, you do have some expansion happening. They are at 4.5-star rating, so they've improved year over year from 4 to 4.5. Most people out there are familiar with the AARP branded products. Just so you know, AARP, you don't have to be a member to join United Healthcare. The Medicare Complete Choice PPO plan, these benefits are for Orange, Osceola, Seminole, and Brevard. They've kind of combined all that into one product, one area. Their HMO is where we focus because obviously it has lower copays. But zero premium, zero PCP, specialist has been lowered down to $25, so moving in the right direction to stay competitive in this market. No deductible on the drugs, however, they do have copays on tier 1 and tier 2. What makes them special is they have a caregiver program where they actually do house calls to help supplement their doctor visits. We really like this, especially when it comes to follow-up on medical, because as you know, some folks, it becomes a little difficult for them to get to those doctor appointments. United does have certain transportation programs available, but what really sets them apart is they can have somebody come out to the house and take a look at their medical situation and report back to you via United Healthcare. So you've got a really strong customer service and medical focused plan when it comes to their HMO in Central Florida. And of course, last but not least is WellCare. WellCare has the largest membership on an HMO here in Central Florida. They've been around just almost as long as Humana here. Orange, Osceola, Lake, Seminole, Brevard, Polk, and Volusia counties. You've got a star rating of 4 stars, which is staying pretty much the same for from year over year. And they've got a lot of new plans this year. So you're going to see quite a bit of WellCare activity. And I'm going to talk to you about what that means. So the 3 new plans that they have is the Elite, the Dividend Prime, and the Reserve plan. The Premier PPO is not a new plan, but it is now available in Orange County. So you're going to see more PPO members on WellCare starting next year. So I actually have 2 slides because WellCare has quite a few plans going on this year. Just to make you aware, the Essential plan, which was their flagship plan, will still be around for next year. So they're not going away from the Essential, but they're going to start to ask us to migrate those members from the Essential plan to their new plan called the Elite plan, which is on the next page here. This is now, the Elite plan is now going to be their focus plan, their core plan, their flagship plan, moving forward from 2019 on. So the PPO is competitive, zero premium, $5 specialist for the PCP, $35 copay improved. They lowered their deductible, but there's still that deductible there. So if you have a person that's complaining about meds, maybe that PPO might not be a good idea. We can move them into one of the HMO products that they have instead. All of their plans have the standard extras here. What I like about WellCare is they have a PERS system. PERS stands for Personal Emergency Response System, and most of us remember the TV commercial where it's "Help, I've fallen and I can't get up." And that is the Lifeline alert. And so WellCare helps pay for that for the members to have it installed in their home. So a great little benefit that's available through WellCare. Also, most recently, they've come out with a service where meals are included for post-hospitalization, acute and chronic conditions, and a healthy meals program for those folks that may be underweight or having health issues where they're not eating properly. WellCare has those programs that are new for 2019, so that's going to be a unique factor as well. Essential Plan is not moving their copays, but again, they've instructed us as a sales force to stop selling the Essential so much and start selling that Elite plan. So that's what you're going to see new membership, new growth on, is the WellCare Elite member list. In Brevard County, there's the value plan that was there from last year, zero premium, zero PCP, $35 specialist. Again, all of them include that PERS, the gym, vision, dental, hearing, and over-the-counter credits as well. They do have a new give back plan this year called the Dividend Prime. Again, this is really kind of reserved for folks that are very, very healthy or new to Medicare. We don't usually recommend this plan. We like to put them on their Elite plan, so Obviously, it helps our provider partners grow and grow in the right way. So the WellCare Elite Plan, zero premium, zero PCP, $15 specialist. So again, this is going to be very in line with what Humana, Simply, and CarePlus are doing to stay competitive in this market. No deductible on their meds. Their generics, whether they're tier 1 or tier 2, are zero. Very doable copays on the brand names and non-preferreds. And again, they include those meals program, the PERS as well, the gym, vision, dental, hearing, and over-the-counter credit. As an added bonus, some members may qualify for social services where they can actually have a member come or a WellCare teammate come in and help with social services, which includes cleaning their house. So they've identified socioeconomic issues where folks are going to the hospital not because they're sick, but because they just don't want to be at home. And if one of those reasons is because they have an issue with where they're living, then obviously welfare is going to try to take the next step to help that. So this has been cleared through CMS most recently, so you're going to see folks that are able to get social services to help them at home. So that's basically all the benefits when it comes to what's happening out there for 2019. I just wanted to go through the enrollment timeline. So we are here in October. Annual enrollment period started on Monday, and we have from October 15th to December 7th. What I would focus on during this time right now is anyone that, including needs to change their plan, but those folks that are on original Medicare only. So if they have Medicare only, they have a very short window to get on a plan, and that is from now until December 7th. So if they need help, you let us know and we'll get them on the plan and we'll get them in your practice. Between December 7th and January 1st, we have what we call a special election period. So only certain situations are people able to change from December 8th to January 1st. So it's kind of no man's land here. But an SEP would be, let's say if somebody is new to Medicare for the first time, or they just moved to the area, or if they're interested in CarePlus or Cigna, a 5-star plan, they can enroll during this time here. Otherwise, we've got to wait until January. Now, this is new for this year. January, we've got a new enrollment period called OEP, or Open Enrollment Period, not to be confused with Annual Enrollment Period. So OEP is going to be from January 1st all the way until March 31st. During this time, I like to call this the boo-boo enrollment period. If they made a boo-boo and they want to go back to their old plan, or they forgot to change their plan, they can do that one time between January 1st to March 31st. During that time, they can only make one change, and it's from like plan to like plan. So for instance, if they're on a Medicare Advantage plan, they can go ahead and join another Medicare Advantage plan. If they're on original Medicare, they cannot join a Medicare Advantage plan during this time. So it has to be like plan to like plan. If they enroll in January, their plan becomes effective February 1st. If they enroll in February, the plan becomes effective March 1st, so on and so forth. And that enrollment period ends on March 31st. On April 1st, we're back into SEP land, and so they have to have a certain circumstance in order to enroll into a plan during that time after March 31st. So we are here now. AEP is upon us. So we have until December 7th to help those folks. With your practice, again, I would focus on reaching out to those people that have just Medicare only. Okay, so with health plan markets, we do assist our partners with marketing strategies to grow and retain your patients. So we do help with marketing. We do everything from newspaper ads to mailers to call initiatives for your practice. We do local events, lots of customer service, and definitely can help those people transition from plans. That's what we specialize in. We are licensed, so we are able to discuss benefits with each of the carriers that we've contracted with. So if you need help with marketing, please reach out to us. We're here to help. You can talk to one of your physician partners reps. We may already have an agent assigned for your office so we can help you grow. and get you new members. Again, our whole value proposition is helping you grow and retain your practices. I train our advisors not only how to sell the health plans, but to how to keep healthy memberships in your practices, and what to do with someone that might be non-compliant or someone that might not be a good fit for risk. So we train our agents on what that means for your practice and how to grow the practice the right way. Most importantly, they understand compliance, and that helps all of us stay out of trouble. So you want to work with an agent that understands how important it is to follow the rules and guidelines so we don't get in trouble there. And of course, our main focus is customer service. When you add one of our guys to your practices, obviously there's no cost to you, but we're here to help with any insurance situation that you might have. So if somebody's coming in and they're just not understanding Medicare, or they need extra help, or they're looking for a new health plan, we're here, of course, to help them answer their questions. Mostly we do customer service. That's 90% of our job. We answer our phones, and we answer their questions regarding their plans. It doesn't take long to fill out an application, but the relationship is what really helps our customers and our clients find great practices to work with. So that's our added value. When you are set up with a marketing rep, an agent, it's their job to go out and look for those health plans. So between now and the end of the year, they are selling, and they're looking for doctors to put those patients with. So if you're nice to them, they'll be nice to your practice, that's for sure. So we can definitely work together on all of those things. If you don't have an agent that you're working with, again, get with physician partners. They can definitely introduce you to a live person that can come by and talk to you about what they have to offer and how we can help. But if you're in a pinch and you have quite a few people that need to move their health plan, and you're not sure on which way to go, you can have the patients call us directly. This is our hotline, and we will set an appointment for them to have an agent come out and talk to them about their new health plan. Easy to remember, 844 My New Plan, or our 844-696-3975. Same number there. That hotline is available Monday through Friday, 9 to 6, and then we are checking it after hours as well. But if they call anytime during that time, we will set up an appointment and make sure to send an agent out to the home so we can discuss one of the plans that we talked about today. And that's it from me. I'm going to open it up to questions. Basically here, we're here to assist your members understanding Medicare, and anything we can do as far as customer service and to help your practice grow, that's what we're here for. Of course, our website is up to date for Medicare, so if you have any questions, you can go there as a resource or send your members there as well, and we'll be glad to help them out. And I don't know if Ashley is controlling the mute button, but does anyone have any questions there for me?
Everyone should be able to unmute themselves if they have a question.
Okay.
Hi, Jacob. My name is Nick Sharma, Narayan Sharma. I'm here in Marion County, but I cover a couple of providers in Lake County. So my question is about Cigna. As you said, the Cigna came with HMO plan in Lake County. So how is their hospital co-pays there, or how is their network in Lake County, whether they are covering all the hospitals, or like how's the provider network in Lake County for Cigna?
So comparatively, they're not as strong as some of the plans that have been there for many years, like Freedom. However, they are still adding providers such as specialists, and they're adding new networks. I do know that they have an agreement with Florida Hospital, so that's how they were able to enter most of these markets, and Orlando Health as well. So they've got both hospital systems for you. So in my opinion, I think that they've got a strong start. It is Cigna, so I mean, if they want to make this market work, they've got the money to do it. So I see them being one of the big players that's going to be around for a long time in our market. But to answer your question, there's still some gaps because they are a new provider in this area, so they have a little bit of growing to do when it comes to the specialists in the facilities.
All right. Thank you.
You're welcome. Was there any other questions for me? Okay.
If there are no questions right now, excuse me, you can definitely reach out to either Justin and Health Plan Markets directly or speak to one of your provider consultants and they'll be able to connect you over. I did want to say thank you to Justin for taking the time to review the plan benefits with us again this year. This is the second time that we've done it, and I hope that those who attended, thank you as well. I hope that you found it informative today and useful. And if there's anything in the future that you would like Justin to change or focus on, we definitely can do that and work together. If there's something that you wish he had touched on in some way, let us know and we can plan for next year. But like Justin said, we don't expect the offices to be an expert in these plans. You're really just trying to identify those couple things that are red flags in order to get the patient on the best plan that they should be on. And as soon as you find yourself questioning if a patient can afford their medications or has transportation issues, that's a great time to either reach out to Health Plan Markets or your provider consultant and try to figure out how we can best help that member. But we just wanted to give you a top-level overview today of the 2019 offerings. If you do have any additional questions, please do not hesitate. But other than that, that would be the end of our webinar today. So thank you, everybody, and thank you especially, Justin.
It's my pleasure, and thank all of you guys for taking time to do this. I know most of you have spent your lunch listening to me yap, so thanks again.
Thank you so much.
Thanks, guys.
Thank you.